Electronic health records were designed to streamline medical practices. Instead, the task of maintaining them has grown to absorb the entire clinic. This chart breaks down the average physician's 57.8-hour workweek. Only 27.2 of those hours go to direct patient care. Another 13 hours are lost to indirect tasks. Of those indirect tasks, providers spend 4.5 hours a day staring at a screen, strictly managing electronic health records. And the work bleeds into the night. 22.5% of physicians spend 8 or more hours a week catching up on charts after the clinic closes. They call it pajama time. Working nights and weekends to close charts is statistically the #1 driver of physician burnout across the country. Administrative teams face a parallel breakdown. The front office staff tasked with managing this documentation are buckling under the exact same pressure. Looking at this line graph, front office support staff hit a 40% turnover rate recently, while business operations teams reached 33.3%. Training a new hire in clinical terminology and specific billing codes takes 4 to 6 weeks. When they quit, the cycle resets, trapping the clinic in a constant training loop. Every single time that loop resets, the practice burns between $25,000 and $30,000 in recruitment, training, and lost productivity. EHR documentation requires clinical familiarity and strict compliance. It is highly specialized, legally sensitive work that mid-size practices struggle to staff effectively in-house. Physicians now spend half their day practicing desktop medicine. It isolates providers from patients and causes a rapid loss of institutional memory. When providers rush through a backlog, mistakes happen. Unclosed charts and coding errors flow directly downstream into the billing department. This flow diagram tracks the penalty. A single incomplete chart multiplies into delayed claims, creating a 20 to 35% drop in practice revenue. Clinics try software workarounds to speed things up. These shortcuts bypass mandatory checks and generate immediate compliance audit risks. Relying entirely on local staff to muscle through bad software actively erodes the practice's profitability and creates heavy structural liabilities. The practices successfully solving this aren't trying to hire another local admin. They are shifting documentation tasks entirely to trained, dedicated support teams. This is the virtual medical assistant, or VMA model. An offshore team handles charts inside the practice's existing platform, working during normal clinic hours. Because healthcare data is heavily regulated, these remote teams operate under strict security frameworks. Frameworks including HIPAA, SOC 2 Type 2, ISO 27001 protocols, and HITRUS aligned standards. Every specialist completes over 40 hours of orientation on a specific practice's workflows before ever touching a live chart. Curing the documentation backlog means changing who does the work and where it happens, rather than asking a burned-out local team to type faster. A remote model allows a practice to leverage a specialized technology stack, including natural language processing and predictive AI, that typically requires the software development budget and data scale of a national service provider. Here, natural language processing scans incoming paragraphs, instantly extracting key data to pre-populate EHR fields. As data streams merge, a duplicate detection system filters out redundant entries before they trigger denied claims. Meanwhile, predictive scheduling smooths out severe volume spikes, ensuring documentation flows evenly. Combining dedicated, highly trained human specialists with AI-assisted data extraction creates a billing workflow that is vastly more accurate and consistent than traditional methods. An in-house EHR documentation specialist, factoring salary, benefits, and turnover, costs a practice $60,800 per year. The Staffingly VMA model provides a dedicated specialist for an all-inclusive $21,600 per year. That gap of $39,200 in annual savings per position is a 64% reduction. Implementation takes 48 to 72 hours. Practices receive daily reports and started 2-week, zero-risk pilot with no long-term contracts. Outsourcing EHR documentation fixes the bottleneck. It eliminates revenue backlogs, stabilizes daily operations, and most importantly, it finally gives physicians their evenings back.